I'm Dr. Dan Cox, a professor of counseling psychology at the University of British Columbia, and welcome to Psychotherapy and Applied Psychology, where we explore practical insights with leading experts. Today, I am thrilled to welcome Dr. Simon Rice, a world authority on men's mental health. In our conversation, we discuss masculine norms, generational shifts, male type depression, substance use, social networks, and much more. Please leave a comment below, and if you enjoy this conversation, it'd be much appreciated if you hit the like button and subscribe to the channel. This episode begins with my guest talking about how he got into studying men and masculinity. Let's jump in.
Great question, Dan. So I probably came to studying men and masculinity and men's mental health almost serendipitously. At the time, when I was starting my master's training in clinical psychology, I opted to do the pathway here. There are a few pathways in Australia, and one of the pathways is combining a master's with a PhD, which is a long course, but great training. And I wasn't quite sure what I was going to do for my research component. And there was a bunch of things that I was interested in. And a colleague who was also in the master's cohort just happened to mention to me this paper that they discovered. And it was the original paper on the Gotland Male Depression Scale. And only a fairly brief paper, and it's work that derived from Sweden, the Swedish island of Gotland, where they had a real interest in better understanding men's depression and in particular men's suicide risk. And they had taken the lens of really being interested in whether there might be something about the depression phenotype that is unique to men. And so some of the foundational work that they did was developing this hypothesized construct of what became known as the male depression. Well, I think it was initially the male depressive syndrome, and this idea that it could be that depression looks a little bit different in men. And coming back to your initial question, when I read this paper, it was just fascinating. Like I said, it was only a fairly brief paper, but just this idea that such an experience that seems fairly well understood within our diagnostic classification systems in psychology and psychiatry. Well, there might be a whole piece to the puzzle that we're not really considering, and that then connected to this world of understanding what the potential drivers of that difference in symptom presentation could be. And socialization, adherence to masculine norms is part of that picture. So that was the point of entry into the field for me.
So why don't we start by sort of getting into the adherence to masculine norms stuff? So just generally, could you tell us what adherence to masculine, like what is that? What does that mean?
Well, it depends on your perspective, really, because masculine norms mean a lot of different things to a lot of different people. And over many years, there's kind of been different terms that have been used, but one that has been used a fair bit in the literature has been this idea of traditional masculine norms. I'm not sure whether that's really quite the right way to express it in the modern world, but what those norms have typically come to be known as are expectations that boys and men experience that define their sense of being a man and their sense of manhood. And many of those, I guess from a research literature perspective, probably align with what we've seen through inventories like the Conformity to Masculine Norms inventory by James Mihalich and colleagues, where they've stepped through these core constructs around the kind of archetypical notions of what it means to be a man. I should add, though, that much of what is in the Conformity to Masculine Norms inventory is a piece of the puzzle, and it's not the whole picture. That those norms are fairly negative in their valence, and they're characteristics that align with dominance, with men's power over women, with men's appetite for sexual conquest and aligning with a playboy type culture. And there's no doubt that there are elements of that resonate for some men in what they aspire to. But I think the picture is much more complex and nuanced than that. And I think the field has some work to do in understanding what modern adherence to masculine norms actually means and reflects, especially for a younger generation, and how that might be playing out. But again, coming back to the initial question, so historically, adherence to masculine norms have been those more negative traits associated with masculinity, and it's little wonder that many of those correlate with worsened health and mental health outcomes. I think a critical piece of the puzzle that we've still got to explore is, much more from a strengths-based perspective, what are the masculine norms that, excuse me, boys and men want to adhere to that can actually be pro-social, pro-supporting their health and the well-being of others.
So do you think that we should, I mean, you're not, I don't hear you saying that's nothing, but I do hear you saying that's only part of the pie. What do you think, like, what's the other part of the pie that you're, at least what I'm hearing is you sort of hinting at?
I think we've got some work to do to identify what that is, and the kind of positive values that men, young men, boys really aspire to. So we've seen a significant movement through meta-masculinity influences in the online space around fitness, well-being, looking after yourself, having fitness goals, getting to the gym on a regular basis. Lots of positives with those messages. There can be some complexities then if that does tip into the world of problematic exercise, the world of using performance-enhancing steroids, and the slippery slope that might entail for some men. And definitely I don't think that's the majority. So I think we've got some work to do around fitness. We've got a fair bit of work to do around relationships and what kind of positive, good social relationships men aspire to, both within same-sex gender relationships and cross-gender relationships as well. So I think it's going to be an interesting few years as we start to get a better understanding of this strengths-based approach.
Well, so one of the things that you've written about, or at least something that sort of jumped out to me, was, at least this is my sort of paraphrasing or interpretation, was it's not so much like that, let me start over, that masculine norms or adherence to certain masculine norms can be a resource, but it's the rigid adherence to them that can get us into trouble.
It's a great point. There's much around dominant masculine norms that is positive in the right circumstance. So you do want men to have a risk-taking propensity or to be self-reliant or stoic when we are entering into complex situations in the emergency services, for example, firefighters running into a burning building. Really important traits that elements of masculine norms that have served men over many, many generations, that they do absolutely need to shine through. If and when a young man or a man is only ever stuck in that mold of rigidly being self-reliant, rigidly only ever being entirely stoic, when they encounter significant challenges in life, like we all do, if those attitudes block formal or informal help seeking, that's when there can be some risk to health. So it is something about the rigid adherence to these particularly restrictive norms that it seems like being able to have an orientation towards greater psychological flexibility would be really useful.
Right. So you've done some work, at least my understanding, indicating that some of the adherence stuff has perhaps been changing over the generations. and that the younger generations are perhaps. I was curious, like where you are in your thinking about that.
I don't think we have a rock solid
Yeah,
understanding of that at this point in
yeah.
time. I think there's some studies that suggest that younger generations of men it might be more flexible. Other studies are contrary to that finding. So
Mm.
I don't think we know. But what we do know is that these broad constructs connected to masculinity, manhood, and men's identity along those lines are really powerful in the lives of boys, young men as they transitioning into their adolescent and then young adult years, and men throughout the life course. So if we are wanting to engage more men in better physical and mental health, it makes sense that we're going to be attuned to those. And so that means, from our messaging in terms of health promotion right through to our interventions, being conscious that these constructs play a major role in men's health, physical and mental, and their help-seeking pathways.
And not to get go too far down the trope rabbit hole of nurture versus nature, but how much of this do you think about as this is socialized versus this is more or less built in?
I don't think we're ever going to be able to fully answer that.
Sure.
Well, who knows? Maybe we will, but I don't see a fulsome answer coming in my lifetime. Um, I think we need to be realistic, thinking through, the lens of a biopsychosocial model, that there are multiple influences. This is complex, and equally so, the solutions need to be mindful of those complexities.
Yeah, I think that one of the things, having done some research in this area, that I'm sort of constantly struggling with and talking with my graduate students and colleagues about is like these traditional masculine norms, if you will, that these are that like a lot of this is sort of this cultural influence and way of thinking about things, and we would expect that these are going to vary from person to person and even from like culture to culture, subculture to subculture. And so like it's sort of like what you were talking about in terms of some of the limitations of how we've always thought about it, right? Here are these 5 or 6 or 7 traditional masculine norms of dominance and stoicism and that sort of stuff that it's this weird construct. I always sort of feel like, because it's like we would expect that this is going to be like ever developing and changing within and between cultures. And so a lot of times I have a student right now working on some projects, and it's like I think a lot of times we're like I'm struggling with like trying to hold on to it and like make meaning out of it, knowing that it has to be at least somewhat culturally dependent.
I think culture plays a profound role in men's mental health, particularly high prevalence disorders, depression, anxiety, probably most significantly. The way in which symptoms manifest is one question, but the way in which men and boys talk about their experience of mental ill health in informal networks with professionals, um, cultural norms have a profound impact on that. So, it you know it we have to be attuned to that, I think.
Yeah, yeah. So let's get into the male type depression. So could you start us off with just sort of what is male type depression?
So the broad construct, as we talked about a little bit earlier, is this idea that men, or maybe subgroups of men, we're not crystal clear exactly who, when, and why, may experience a different cluster of symptoms when it comes to depression. We have had a pretty robust understanding of major depressive disorder from a DSM and an ICD perspective for some time. And that's where you're talking about that prototypical sadness, inability to experience pleasure, and a range of psychological range of physiological symptoms, including kind of probably its most severe form, thoughts of suicide and wanting to harm oneself. So the idea is that whether it's through some biological process, whether it's through socialization, whether it's through a combination of those factors, that some men may not necessarily adhere to the 9 DSM type symptoms of depression, and that their experience might manifest through what is sometimes referred to as an externalizing set of symptoms. By that, we mean things like anger and aggression, risk-taking, substance use, where there's a more outward experience and expression of a potential internal distress. So this idea has been around for quite some time, and there's growing support for it, but it's definitely not it's definitely not a fully accepted idea within all circles within clinical psychology and psychiatry. It's interesting to note that there have been some relatively recent kind of national campaigns around what depression symptoms in men might look like. And it is common that those national campaigns will talk about things like anger and aggression being a symptom of depression in men. But when we look at our diagnostic criteria, that doesn't pop up. So we've kind of got this mismatch between what some of our public health messaging is, and then when and if a young man or a man attends primary care and they're presenting with some of these symptoms, unless that physician, that general practitioner is particularly attuned to some of the research literature, they're not going to be able to diagnose or identify a potential underlying depression, because that's not what our diagnostic criteria says. We have this interesting flavour also within the DSM that irritability can replace one of the prototypical criteria for depression if and when the person is under the age of 18. But then once they reach 18 again, it needs to be sad mood rather than irritable mood or depressed mood. The ICD-11 has taken the significant step towards relaxing that requirement just to be limited to 18 years and under. And I think that's a really interesting step in recognition that yes, there can be a different picture of depression that can be represented. And it's going to be fascinating to see whether the DSM follows suit once the DSM-6 is revised.
So just to sort of summarize, what I'm hearing you say is that it's right. So when we think about psychiatric disorders, we think about like this latent construct, right? So in this case, a depression, major depressive episode, depressive disorder, and then our symptoms. These are the manifestations of depression, right? The ways that we observe depression in a particular person, because we can't, unlike some physical diseases, we can't, well, even in that case, right? But we can't directly observe depression. We can't say there's the depression, that's it. So we have to have these, for some reason, for me, manifestations is always like a way for me to think about it that makes sense. These manifestations are these indications of the disorder. And so what I'm hearing you say is that the indications or manifestations that are in our traditional assessment guidelines, whether it's the ICD or the DSM, that those miss out on a lot of the symptoms that men would have that would be an indication or manifestation of this latent construct of depression.
That's the hypothesis, exactly. And there's evidence that supports that. And it's going to be fascinating to see where the field moves within the next 15, 20 years. Because you can also understand the perspective of relaxing some of this diagnostic criteria around a disorder like major depressive disorder, which is highly prevalent in the community. Through adding a new criteria, relaxing a criteria, the numbers of people that would potentially qualify for that diagnosis significantly increase. So there's probably some balance point that the authors of diagnostic criteria are thinking about through the the research evidence, pragmatically around what our care systems can support. That said, I think we do have a problem at the moment that there's a cohort of young men and men who, whether they're presenting to primary care or not, are experiencing some form of psychological distress, dis-ease, and potential risk, whether it's in the moment or in the near future, to their own mental health through suicide risk and other harms, who aren't necessarily being identified. And so part of the construct of better understanding men's depression is, can we get better at identifying this cohort who might be at significant risk of suicide or other adverse outcomes, and can we identify them earlier and then provide support and intervention earlier in the piece? Obviously, there would be some people who would push back on that idea and argue, well, that's not necessarily a justification to relax the diagnostic criteria for depression. We just need to be better understanding people's presentation from a psychosocial perspective. And I would argue, well, yes and no, because when we look at some of the qualitative research on men's experiences of depression, that there is a lot of similarity with some of these constructs around irritability, anger, aggression, challenges with regulating emotion, relating to others in challenging ways, using substances to cope. All of this is part of this broader constellation.
Right. Yeah, I had Bob Kruger on here last year, and he was, one of the big players in the DSM-5 personality disorder stuff, and sort of for the DSM. And in talking to him, I definitely developed more empathy for the people who are developing these criteria. He described it as like trying to repair an airplane mid-flight. So, I do have some sympathy for that sort of or for people who sort of push back and say, if we relax everything, it's going to be, we're opening the floodgates and more come in. At the same time, the argument of we just need to train clinicians to better understand the sort of the social cultural factors that are impacting people's reporting of things, that seems like a pipe dream. I mean, it's a great one. I mean, I'm not opposed to it in any way, but, having done a lot of diagnostics and given structured clinical interviews and all, done a lot of that sort of stuff, the reality is that it does come down to the symptoms that are articulated in the DSM or the ICD.
It does, and that becomes the lens with which people are trained, and then the lens through which we make diagnoses and then support our interventions. A couple of quick points to add is it is useful to note that the text revision of DSM-5 did add some sentences around sex and gender considerations, that men with depression are more likely to experience challenges managing emotions, substance use. So there is definitely a growing awareness of this literature from the committee who are working on, revising diagnostic criteria for major depressive disorder. That hasn't translated into an actual change into the criteria themselves. And a point that with some colleagues I had recently made was, even with the positive move with the ICD-11 being more open to the inclusion of irritability across the life course, that does have obviously identification assessment implications, and then by virtue of that, treatment implications. Because what then are we thinking about if many of our standard treatment protocols for depression have really focused on the anhedonia or the sad mood component, if that's now irritable mood? It raises some interesting questions there for what we need to be thinking about from intervention too. So this work has tentacles going in lots of different directions.
Yeah, for sure. So why is it, do you think, or sort of the general thinking around why is it that depression manifests or can manifest differently in men rather than compared to women?
Again, we don't know, and I do acknowledge that this is a contested area, a contested space. Much of the theorising has been based on socialisation.
Okay, so it's mostly just that. Hmm. Interesting. I'm thinking about if I'm thinking I'm sort of one of the interesting about doing one of the interesting things about doing work with on men and masculinity is it's I'm always able to like think about it relative to me. Like where does this hit home for me personally or my I'm sort of thinking about that and Lord knows I can get irritable. And I'm trying to think about how much of that is how much of that is learned versus automatic. I don't know. In some ways, it is a little bit, I haven't thought about it too much, but a little bit of difficulty just sort of accepting it's fully learned.
Yep.
I don't know. What are your thoughts?
And that may well be the case. And if we thought a bit more broadly around, another symptom cluster around problematic substance use, so we
Right.
know that men are more likely, for instance, to use alcohol to manage challenging experiences in life, and often that can be attributed to less robust, supportive social support structures. So it would be interesting to think if we were able to better support young men and men
Mm-hmm.
have closer, supportive relationship structures that buffered them throughout their life course, that perhaps they might not need to turn to alcohol or other substances as a coping mechanism as much. And if that were to hold true, we could see significant population health impacts.
Mm-hmm. And much of men's socialization, and this is true with women, but I would guess, at least in much of the world, more so with men, is socialization is often surrounded by alcohol or involves alcohol or substances.
There is overlap there for sure. And we also know across the life course that as men age, for many men, their social relationships and their social networks become thinner, and some of those bonds become less strong.
Huh.
And it's the inverse impact for women, that those social relationships often become stronger and the bonds deepen. And so there's something going on at that larger social relationships level that might be implicated here as well.
So as men get older, their networks get thinner, as you said, decrease.
They do. That's on average, obviously not
Right,
the
of
case
course.
for all men, but for many men. And a consequence of that can be that women, female partners, female family members, become the person that navigates the social world of men and reminds them or organises their social contacts. Again, not exclusively true, but if that does become the case, men can sometimes become de-skilled as the life course, as they work their way through the life course.
Huh. Are there any sort of reasonable explanations for that you've come across?
I don't know what the core drivers of that are, but it's definitely something that the Movember Institute of Men's Health has a particular interest in, that we want to see men and young men develop strong, robust relationships that can buffer them throughout the life course, that they can be supported and they can also support others around them. And so thinking through ways that we can get a better understanding of this is going to be key before we can even start to think what the solution is.
So I don't know the literature on this, but I've sort of heard in popular media where folks will talk about like young men now, so people who are younger than me, people in their teens and 20s, men, boys, that they are struggling more to develop relationships than older generations of men were. Do you have any sense of that?
I think seen some extraordinary shifts in the COVID, post-COVID world, and disruption to education, disruption to, kind of social pathways for that cohort of young people. And, the implications of that, we're still working our way through. I think what has shifted seems to be this, much of the shift to and the influence to online worlds, and the influence of, in particular, men and masculinity influences in the online space, that there is clearly a need that young men are experiencing, whether that's a need for guidance, mentorship, even if it is through a person who they don't have a direct relationship with, still being able to seek out and experience some benefit from that guidance. And there's great opportunity, but there's also some risk there in terms of some of the voices that young men are being exposed to and are listening to, and the motivations of some of those voices as well.
Thanks so much for watching. If you enjoyed this conversation, don't forget to like and subscribe, and be sure to check out the second part of the conversation. Until next time,